Strategies for working in interdisciplinary teams are focused on Mr. Zhang Wei. Slide 3 Introduction. Mr. Zhang, a 42-year-old male patient, recently visited our primary healthcare facility to address a foot infection. The condition arose from friction between his shoes and feet, highlighting the importance of proper footwear to prevent further injuries. Mr. Zhang immigrated to Australia from China at 17 years old. He embraces his identity as an Australian while also cherishing his Chinese heritage. At home, he speaks Mandarin, which reflects his appreciation for his roots and culture. He resides with his wife and two children who are 10 and 12 years old. Currently, he works as a construction worker for one of the local construction companies, contributing to the development of the community. Illnesses and comorbidities deconstructed. Type 2 diabetes mellitus, HbA1c 7.5%. Mr. Zhang is an individual managing type 2 diabetes mellitus. As noted by Diabetes Australia 2021, type 2 diabetes mellitus develops when the body becomes resistant to insulin and slowly decreases its ability to produce sufficient insulin in the pancreas. This condition highlights the importance of Mr. Zhang's understanding of how the body processes sugar and the need for effective management strategies. Apala 2020 notes that an HbA1c level higher than 6.5% indicates diabetes. Mr. Zhang's recent HbA1c results indicate that he has been poorly managing his diabetes at home. While the duration of his experience with this chronic condition is currently unspecified, this journey presents opportunity for person-centered care coordination strategies to improve his diabetes management at home. Slide 5, Hypertension and Body Mass Index of 28. Mr. Zhang also experiences hypertension. Several things can cause hypertension, including high sodium diets, being overweight or obese, smoking and alcohol, and etc. Heart Foundation 2024. According to World Health Organization 2023, the majority of individuals with hypertension do not experience any symptoms. However, extremely elevated blood pressure levels can lead to headaches, vision disturbances, chest pains, and other related symptoms. Therefore, it is important to consider this when doing an assessment. Mr. Zhang's BMI is 28. The World Health Organization 2024 defines individual with excess body fat and BMI of 25 or higher as being overweight. In this context, it appears that Mr. Zhang falls into the overweight category, and given his type 2 diabetes and hypertension, he may be at a heightened risk for cardiovascular diseases. Therefore, understanding this classification by Mr. Zhang can be a valuable step towards health promoting activities and making lifestyle adjustments to reduce its risk and improve its overall well-being. Slide 6. Foot infection. Individuals with type 2 diabetes, like Mrs. Zhang, face an elevated risk of diabetic foot complications when experiencing foot infections. These complications include osteomyelitis, which may necessitate hospitalization, prolonged antibiotic therapy, and potential limb amputation. According to Lavery and others, 2025, those who suffer from reinfections are particularly susceptible to extended hospital stays, an increased likelihood of amputations, and longer treatment durations with antibiotics. Therefore, by implementing effective care coordination and early management for his foot infection, we can help prevent potential complications and promote better health outcomes for him. 7. Medication. Metformin 500 milligram 3 times a day, an oral hypoglycemic agent to control high blood sugar and manage his type 2 diabetes. MIMS 2025. Captopril 12.5 milligram twice daily. It is an antihypertensive agent used as an angiotensin converting enzyme inhibitor or ACE inhibitor, according to MIMS 2025. According to the American Heart Association and the European Society of Cardiology, it is the first-line treatment for lowering hypertension in individuals with diabetes and cardiovascular diseases. Hammond and Bassett, 2023. 8. Identified care needs and what Mr. Zhang requires from the healthcare system. Mr. Zhang's specific care needs demand a tailored, person-centered care approach from the healthcare system. This ensures that he receives the personalized support essential for his well-being using Pickett's 8 Principles of Person-Centered Care, as explained by O'Neill 2022. The 8 Principles of Person-Centered Care are designed to thoroughly meet Mr. Zhang's unique care needs by fostering a holistic and personalized approach. These principles encompass the following: respect for the patient's preference, coordination and integration of care, information and education, physical comfort, emotional support, involvement of family and friends, continuity and transition, access to care. Slide 9. Mr. Zhang will need a network, service providers, and multidisciplinary team to support and coordinate his care effectively. Given his current situation, it would be beneficial for him to consult with the following professional: GP, to address food infection, elevated HbA1c by providing pathology for lipid profile, complete blood counts, kidney function test, script for medication, referrals for ultrasound and x-ray of the foot, ABIs and diabetes foot clinic, referrals to cardiologists and endocrinologists, initiate a GP management plan for his type 2 diabetes, team care arrangement referrals to allied health services, and determine his immunization needs. Practice nurse would address wound care management and checking of his blood pressure. By creating rapport, checking his vital signs, including blood glucose levels, doing ECG, assessing Mr. Zhang's wound and dressing it using evidence-based wound management strategies, providing patient-centered education on his condition, follow-up on test results for Mr. Zhang, and placing him on records. Diabetes educator to address elevated HbA1c and poorly managed type 2 diabetes. Will provide personalized diabetes care plan, diabetes education that targets his needs, providing patient care centered care strategies to manage his type 2 diabetes, and navigating him through resources like Diabetes Australia and National Diabetes Subsidies Scheme or NDSS. A podiatrist will address his foot infection, foot care and assessment by providing patient-centered foot care plan, clean and trim Mr. Zhang's toenails safely, foot measurement for feet for prescribed orthotics for his foot protection, dietitian to address overweight, hypertension, poorly managed type 2 diabetes by providing personalized diet plans to accommodate low sodium diet and diabetes friendly diets. Mrs. Zhang will also see an exercise physiologist for cardiovascular risks to provide personalized exercise care plan, an optometrist to do an annual eye check, as Mr. Zhang is a construction worker and also part of his diabetes cycle of care. He will also see a psychologist to address his fear relating to medication and disease process. So psychologists may provide person-centered coping strategies. Pharmacists to address scripts, to fill his scripts and giving specific instructions for each medication. And we'll also see a phlebotomist, lab technician, and a sonographer to address pathology and investigations by taking Mr. Zhang's bloods and sending off to lab for analysis and reporting, for ultrasound of the foot, kidneys, and foot X-ray of for X-ray of foot and for ABIs. Slide 10. Explication of care coordinator's role in assisting Mr. Zhang's care needs. A case conference for Mr. Zhang will be arranged involving his GP, health workers, practice nurse, and his family to address his needs collaboratively. This meeting will be a crucial first step in creating coordination strategies for the interprofessional team, and care coordinator to support Mr. Zhang during his disease journey. Involving Mr. Zhang and his family in discussions is crucial for them to share their preferred communication methods and actively participate in managing his care. Barnett and others, 2020. Our person-centered care approach is essential for supporting patients and their families, as Nat and Hungerford 2011 highlighted, while maintaining respect and patient confidentiality in culturally safe practice. Nursing and Midwifery Board of Australia 2018. The care coordinator can provide valuable support to Mr. Zhang and his family by assisting them in various ways. 1. Creating a personalized care plan for Mr. Zhang to address his immediate health concern effectively. 2. Create a personal timeline for Mr. Zhang and his family to ensure his key care needs are met on time. 3. Liaising and linking Mr. Zhang with the interprofessional team, Victoria Government 2024, in a person-centered collaborative approach. 4. Organizing transport to assist him in getting to his appointments, pharmacy, pathology, and imaging, and encouraging Mr. Zhang to book his future appointments. Slide 11. Articulation of communication, interaction, and collaboration is required from the intraprofessional and interprofessional teams throughout the patient journey. As stated by the Health Innovative Network 2016 and Yan and Choi 2019, Mr. Zhang should be seen as an equal partner in planning, developing, and evaluating his care to ensure effective care coordination. Effective communication, interaction, and collaboration are required to maintain safety, ongoing care coordination. PHN Tasmania 2021. Establishing trusting relationship, Futura and others, 2024. Slide 12. Adequacy of shared information system. In order to promote collaboration among team members, improve patient safety, drive innovation, and achieve optimal patient outcomes, Mr. Zhang's clinical information can be shared and accessed by the intraprofessional and interprofessional team through the following. 1. My Health Record. 2. Practice software. 3. GP management plan. 4. The viewer. 5. Australian Immunization Register. 6. team care arrangements, 7 referrals, and 8 scripts. Slide 13. Methods of communication required between the care coordinator and the healthcare team. Effective care coordination of Mr. Zhang's care requires verbal and written communication for him and his family. This should include a comprehensive care plan and face-to-face meetings with the care coordinator. Such measures will enhance understanding, collaboration, and healthcare outcomes. Effective communication between the allied health professionals and Mr. Zhang's coordinator is crucial and includes both verbal and written exchanges. This ensures that care recommendations are clearly communicated and accessible, allowing for a comprehensive and cohesive care tailored to Mr. Zhang's needs. Communication between the care coordinator and the GP clinic is vital for patient care. This includes verbal methods like phone and face-to-face meetings and written correspondence to ensure effective information sharing. Effective communication between the care coordinator and the specialist is essential and must encompass both verbal interaction and written correspondence, whether through email or traditional letters. This multifaceted approach ensures clarity, enhances collaboration, and ultimately leads to better patient outcomes. Communication between the care coordinator and the practice nurse through phone calls, face-to-face meetings, email correspondence to ensure collaboration and quality of care, review of the foot infection. Communication between the care coordinator and the pharmacy, pathology, medical imaging will require verbal, including face-to-face or telephone. Slide 14 exemplifies how continuity of care will be established and maintained. Why? Continuity of care is crucial for achieving the best results during transition from the hospital to home after discharge. Barr and West, 2018. Pereira, Gray, and others, 2018, argue that an ongoing relationship between patient and healthcare providers is vital in general practice. It enhances patient satisfaction, boosts engagements in health promotion, improves adherence to medical advice, and reduces reliance on hospital services. Royal College of General Practitioners 2020 states that the benefits of the continuity of care emphasize the importance of establishing long-term relationships in the healthcare system, which can improve patient satisfaction and healthcare outcomes. Therefore, in cultivating a robust patient-provider relationship with Mr. Zhang, trust and respect must be developed between parties. This may result in improved outcomes of his HbA1c, better knowledge of his foot care in preventing diabetes foot complications, and reduction in his BMI and improved blood pressure readings. Slide 15 exemplifies how continuity of care will be established and maintained. To ensure seamless continuity of care for Mr. Zhang, the following essential measures must be established holistically. Continuity of care strategies for Mr. Zhang will involve his GP appointments will provide an avenue for the GP to address scripts, repeat of bloods such as HbA1c and other necessary blood tests, investigations such as echocardiogram, ultrasound of the kidneys, 3 monthly reviews of Mrs. Zhang's GP management plan, diabetes cycle of care, updating team care arrangements, referrals, specialist referrals if Mr. Zhang needs it, immunization needs, annual health checks, driver's medicals, update is recalls on is file. This aims to empower Mr. Zhang in effectively managing his chronic condition and associated comorbidities. To proactively identify potential complications, it is important to monitor for conditions such as peripheral neuropathy, retinopathy, atherosclerosis, blood clots, kidney disease. Early detection can significantly improve Mr. Zhang's outcomes and quality of life, and also provide education and prevention of vaccine-preventable diseases like influenza, pneumococcal disease, and shingles. Continuity of care will also involve the diabetes educator in reviewing of Mr. Zhang's person-centered diabetes care plan and reinforcing diabetes education tailored to reducing his HbA1c. This aims to empower Mr. Zhang to understand better strategies he can use to manage his type 2 diabetes, which may result in improved HbA1c readings. Ongoing continuity of care will also include the podiatrist trimming his toenails, providing professional foot assessment and structures impacted by the infection and measurements of his foot. These strategies aim to provide personalized treatment and education for Mrs. Zhang's foot, and also giving him preventative measures such as prescribed orthotics that can prevent diabetes foot complications. It will also involve the dietitian reviewing personalized care plan with regards to his eating and exercise plan so that adjustments can be made to Mrs. Zhang's food preference. This aims to evaluate Mrs. Zhang's tailored dietary plan and also aims to create personalized measures that may help reduce Mrs. Zhang's BMI and HbA1c and improve his hypertension. Continuity of care will also involve exercise physiologists to establish a personalized exercise plan for Mr. Zhang. This aims to improving Mr. Zhang's general well-being, and this may also help reduce mental clarity, HbA1c, and hypertension. Continuity of care will also involve the pharmacist, who may be able to provide education on side effects, when and how to take them, and other relevant information on Mrs. Zhang's metformin and captopril. This aims to empower Mr. Zhang and to address medication-related anxieties. It can also aim to improve compliance with his medication. In doing so, it can help in controlling his blood sugars and therefore manage his type 2 diabetes and hypertension. Continuity of care will also involve the optometrist to do annual eye tests and check eye structures professionally for the surveillance of retinopathy, a diabetic complication that can cause permanent blindness. Continuity of care will also include the nurse, or the practice nurse, by checking his blood pressure, reviewing his foot infection, immunization needs, and attending recalls. This aims to evaluate Mr. Zhang's blood pressure, wound infection, and update his GP accordingly. It also aims to provide the opportunity to do an immunization audit to determine what vaccines Mrs. Zhang may be eligible for. Resources relevant to these vaccines can be provided to Mr. Zhang so that he can read and make informed choices. Slide 16 exemplifies how continuity of care will be established and maintained. Therefore, to maintain continuity of care for Mrs. Zhang, healthcare professionals must be actively registered with the Australian Health Professional Registration Agency. Additionally, GP and allied health professionals must maintain up-to-date provider numbers to further enhance the quality of care. These providers should be incentivized through critical financial support programs, including those focused on rural healthcare, workforce development, and practice incentives. Service Australia 2024A. In addition, practice software and systems must be securely registered with PRODA and Health Professional Online Services, HPOS, and recall system must be effective to ensure a robust and effective continuity of care. Slide 17. Availability and unavailability of communication modalities linking patients across various settings. For Mrs. Zhang, the key communication channel linking him to diverse healthcare settings include telehealth services offered through Queensland Health Telehealth Services. This program helps patients get quality care closer to home using telecommunication. Queensland Health 2019. This would make it easier for Mr. Zhang and his family to access specialist services and reduce need to travel for specialist advice. Slide 18. Patients' participation, non-participation in decision making. While Mrs. Zhang has the physical and mental capacity to participate in decision making, his Chinese background, job as a construction worker, potential low health literacy, and language barriers create challenges that may prevent him from making decisions about his health care. He may encounter healthcare professionals who are unaware of his cultural needs, resulting in less culturally safe care. Also, limited funds may make it hard for him to pay for his healthcare service needs. His potential health literacy, low health literacy, makes it hard to decide about his healthcare needs. According to research, it found that sociocultural barriers lead to marginalized Black and minority ethnic groups receiving substandard care, resulting in significant dissatisfaction with the healthcare services. Wright and Adi Orson, 2009. Considering Mr. Zhang's sociocultural status, this may present a significant barrier to his full participation in healthcare decision making within a person-centered care coordination framework. This challenge inevitably contributes to suboptimal health outcomes, highlighting the urgent need for strategies that empower individuals like Mrs. Zhang to engage more meaningfully in their own care. 19. Advocate and justify targeted system-wide changes needed to coordinate ongoing patient care better. Ongoing care coordination for patients, including Mrs. Zhang, requires a collaborative approach. Research has shown that a multidisciplinary collaboration approach in care coordination aids in subjects with improved health outcomes. Cahill and Paulus, 2024. However, creating cultural safety for Asians like Mrs. Zhang in care coordination within a Australian healthcare system poses a gap in the literature. A study by Torres, Stone and colleagues, 2020, in the mental health context, found that language barriers make it hard for people to access mental health services, especially when interpreters are not available. This suggests that Mrs. Zhang, who prefers to speak Mandarin, might face considerably challenges understanding his care plans and treatment instructions in English. Australia has one of the best healthcare systems in the world. Our healthcare professionals follow clear guidelines that promote high standards and ensure patient safety. This includes respecting cultural safety as outlined in the framework created by the Nursing and Midwifery Board of Australia 2018. To minimize risk for ethnic patients like Mrs. Zhang, the healthcare system should implement mandatory training for health professionals on understanding diverse culture and languages to address potential culturally unsafe practices. For example, having Mandarin speaking professionals in the healthcare system directly involved with Mr. K, Mrs. Zhang would create a culturally safe environment for him to express his concern. This would remove the need for an interpreter and maintain robust, ongoing care, improving health outcomes for Mr. Zhang and his family.